We are back on the Hampton Road Show, and there are several types of sleep apnea, and the most common is called obstructive sleep apnea, and it could be the reason you're not getting the sleep that you need. Dr. Karen Wuertz from Craniofacial Transformations specializes in treating obstructive sleep apnea. Thank you so much for joining us again on the show.
Thank you for having me.
Now, for folks who don't know, what is it? What is obstructive sleep apnea?
Okay, it's a form of apnea that occurs while you sleep at night, and what happens is the back of the throat muscles relax and close off your airway, so while you're sleeping, you're not getting the oxygen that you need to breathe.
Snoring?
Snoring,
One
yeah,
of the
very
symptoms,
common.
yeah.
Excessive daytime sleepiness, lack of focus and concentration during the day. Sometimes people wake up in the middle of the night gasping and choking for air.
Oh, that's dangerous.
It's very scary, yeah. The heart rate drops and the blood pressure drops, and in some cases can be very serious and even life-threatening.
So it can be anything from mild snoring to life-threatening, very serious.
Absolutely, yeah.
What can we do about it?
Well, there's several different treatments, and first thing we want to do is make sure it's properly diagnosed.
Sure.
If you have any of the symptoms that I talked about, or you can find some on my website, you want to make sure that you go to your primary care physician. You might be referred to a sleep medicine physician where they're going to do a couple of tests to find out what's happening to you while you sleep at night.
Yeah, just to get a correct diagnosis.
Make sure. Right.
And there are appliances that can help.
Yeah, they are. I think most people are very familiar with the CPAP machine, which goes over your nose or your mouth and puts pressure through to open up your airway. Well, one of the alternatives to it
That's a lot of gear.
That's a lot of gear.
Yeah.
It's difficult to travel with. It's difficult to keep clean. Some people have some significant side effects from it. Some people are claustrophobic.
Oh, sure.
And sometimes it makes a lot of noise or it doesn't fit right. I will tell you it is the gold standard. It is what works 100% of the time if a patient can tolerate it. If they cannot tolerate it, we have an alternative, and that would be a dental sleep appliance.
Okay, let's show us.
Well, let me show you a couple of them. One of the nice things about it is that it's custom made. This one here fits directly in the mouth. It has a guard on the top and a guard on the bottom, and as you can see, it's as small as the palm of my hand. Easy to travel with, easy to wear. It has to be fitted by a dental practitioner, a dentist who has specialized training in obstructive sleep apnea. And essentially what this appliance does is reposition your lower jaw forward to actually mechanically and physically open the airway while you sleep. This one here is usually used for mild to moderate sleep apnea. This one here is more for moderate to severe. And if you're a little bit claustrophobic, don't be afraid, because you can actually open and close and move your mouth while you're sleeping.
So why is this one for more severe issues? What is the difference between these two that makes this one a little stronger?
Yes, well, as you can see, this one has metal connectors here on the side.
Okay, yep.
Yeah, and what happens is we want to make sure that we keep that jaw in a very forward position. For people with mild sleep apnea, we only need like rubber band types of connectors.
Okay.
It's a little bit smaller, not as strong. We also know that some people who clench their teeth and grind at night will actually kind of break these other appliances. So that's why we need a proper diagnosis to know whether or not you have mild, moderate, or severe sleep apnea.
How can a person get one of these?
You want to make sure that you have a dentist that has some specialty training in obstructive sleep apnea. There can be some side effects, and there's a break-in period where people have to kind of wear them a couple hours a night, just like a CPAP machine. There's some transition time with it, but we want to make sure, because we're repositioning the jaw, we want to make sure that people don't have underlying dental conditions, loose teeth. We want to make sure that going into an appliance that the jaws are healthy.
So once we've gone through these processes to see if we're a candidate, where do we get one of these
Where do you
appliances?
get one? Yeah, well, certainly I provide them at my practice in Elizabeth City and also here in Chesapeake. But you can go to websites. The American Academy of Dental Sleep Medicine has doctors who are specially trained in it. And also you can go ahead, I have to say, you can look on the internet, but you want to make sure. There are a lot of dentists who actually make these appliances but do not have specialized training in obstructive sleep apnea. One thing I would caution is do not purchase the Boil and Bites online.
That doesn't sound safe.
It's not safe. And the other thing is that you can put them in your mouth. They don't fit properly. They can loosen your teeth. If you have gum and bone disease, it could make it worse. And the other thing you want to make sure is you don't move your jaw in an inappropriate position. That could actually harm your jaw and give you TMJ problems.
Got it, sure. It can lead
no
to worse problems.
No self-diagnosis and no self-care.
Thank you for being here
Thank
today.
you.
We appreciate it.
Hi.
It's Karen Wuertz, DDS Craniofacial Transformations, 676 Battlefield Boulevard in Chesapeake at Suite A. She's also in Elizabeth City. Here's the Chesapeake phone, actually the Elizabeth City phone number, 252-335-4341, and the website is craniofacialtransformations.com.